Plan for us today is to do a patient assessment Jeopardy, which is based on the National Registry exam. We have that new EMT exam that's patient assessment focused. We thought it'd be a great way for us to do that here. And here we go. All right, I've got a teacher from high school offering extra credit. All right, I like it. It is not a coincidence. Here we go. Things are good. Patient Assessment Jeopardy. My name is Dan Limmer. I am the Chief Knowledge Officer and a co-founder of Limmer Education. And I am an author of the Yellow EMT textbook. If you had that textbook is mine. And there we go. And I've got to get used to a little bit of a timing. There's a little bit of delay between what I'm seeing and what you're seeing. So I'll get into that swing and do that and get started with our Jeopardy questions. I'm going to pop Jeopardy up on the screen here for a little bit. But like I said, we do have a patient assessment focus for tonight. Now, I talk about EMT. If you're an AEMT or a paramedic, if you are taking that exam too, you're going to be fine. Patient assessment is always good. The EMT exam, between size up and primary assessment, you're looking at about half of the exam. Now, don't freak out because it's mostly the same questions that have been recategorized, but it's safe to say that there's an assessment focus. So, and questions here are coming in. I've got an EMT class here that's really great and a really great question. Any advice to focus on towards the new test? Yes. Patient assessment focus, but you still have to know everything from class. But multiple response questions where you get 2 of 5 or 3 of 6 choices, and there's no partial credit. You should expect a fair number of those and be prepared and practice for those. Limmer Education Apps, by the way, has those in there now. All right, so that's really the big thing. You may see a few TEI questions, the drag and drops, but not a ton. Otherwise, people are reporting that pass rates are still good and everything's good. All right, so it's time to go. So in the chat, I'm going to start with size it up for 100. However, you can pick the next one. If you want to write in, I try and go with the choices from people that put this in. So as we start this, the topic size it up, primary priorities, secondary assessment, pathophysiology-based assessment, and assorted assessments. And here's the first one, size it up for 100. Type your answer in the chat. The medically related cousin of mechanism of injury in the scene size up is known as this. Aspen jumped in there pretty quickly. They do get harder as we go on. I need you to know that. It will get harder as you go on. All right, we got some good answers here. Let's see if the nature of illness is in fact the correct answer, which people are putting in there, NOI. Coming up on your screen, you will find that nature of illness is in fact correct. Now, everything about this is teaching. Now, we're going to talk about more of the components of the scene size up. Nature of the illness is known as NOI. It's the medical equivalent of mechanism of injury. If you walk up and you see big damage to a car, that's the mechanism. But if you walk in and somebody looks unresponsive or they got a closed fist to their chest, that's the nature of illness. All right, do we have any requests then for the next one? I'm going to start picking here in a second. If I don't see, I'm going to go over to assorted assessments for 100 while we're waiting here. And we're going to pop this up on the screen. Assessment, according to the National Registry, is going to be relatively broad. So let's take a look at what assorted assessments for 100 gives us. This diabetic emergency usually presents with moist skin. All right, we got lots of choices coming through here. All right. Oh, look, we've got some Jeopardy style there. That's really great. All right, we got hypoglycemia. All right, we got lots of choices too coming through for the next ones. I like that. All right, this diabetic emergency usually presents with moist skin. Well, hyperglycemia often results in frequent urination and dehydration. So hyperglycemia is not the answer. However, what everyone is typing in here, hypoglycemia, is in fact the correct answer. Hypoglycemia. I like that. Now we're going to go on here. I'm just scanning through here. All right, I've got so many people, and people are going for the big money here, going for the 500s. All right, we got some requests for 500s. Let's do a sorted assessment for 500. And the answer, oh, it sounds so Jeopardy of me, doesn't it? And the answer, bruising around the umbilicus resulting from abdominal bleeding is known as this sign. Bruising around the umbilicus resulting from abdominal bleeding is known as this sign. All right, see, we got to 500. This became tougher. East Central Illinois EMS system got the answer, as did Taylor and Queen China and Sarah. We had one response that said care sign. Care sign is a medical term for referred pain to the left shoulder caused by peritoneal irritation. It's not care sign. However, I'm going to put this up on the screen here so we can see this. And the correct answer is, what is Cullen's sign? Cullen's sign is bruising around the belly button. First found by, not surprisingly, Dr. Cullen, it was originally observed in ectopic pregnancy. It's a place that blood tends to accumulate in other forms of abdominal bleeding as well. So we got that. All right, so let's go back and we're going to pick, what do I see on my screen here for the next one? Pathophysiology based for 500. All right, coming up on the screen. This causes, here we go, this causes the diastolic blood pressure to rise, contributing to a narrowed pulse pressure. Sometimes I get them right. Now we're in the 500 level. Narrowed pulse pressure is the difference, pulse pressure is the difference between the systolic and diastolic blood pressure. What causes that diastolic blood pressure to rise? I'm looking for now, I get that it happens in shock, but what's the actual physiologic mechanism that makes the diastolic blood pressure go up? Your wife? Tony got it. All right, this is a tough one. Let me go. I'm gonna pop the answer up here for you. Remember that narrowed pulse pressure is when you have the difference between the systolic and the diastolic is less than 25% of the systolic, right? So if the systolic is 100, you'd want to have a diastolic of, 75 or so, get, 25, a quarter of that difference. Well, the answer is increased vascular tone. Let's talk about pathophysiology just for a minute. When I have shock, let's say it's hypovolemic shock, my cardiac output goes down because I've lost blood volume. But what makes the diastolic go up? Vasoconstriction, an increase in vascular tone. So while I lose fluid, my stroke volume goes down. And while I have vasoconstriction, my container gets smaller. That's one of the ways the body compensates. So remember, the systolic blood pressure represents the cardiac output. The diastolic blood pressure represents vascular tone, what's going on in the vessels. That vascular tone increases, that diastolic pressure goes up. All right, you get that? Okay, I'm going to take a peek here to see your mother-in-law. Well, I can do that. These questions aren't from the test itself. Primary priorities for 300. They're not from the test itself. These are concepts that I chose specifically to cover assessment, but also to do a little bit of teaching with each one that we do. Now, primary priorities for 300 is coming up on your screen. And the answer, occasional gasping breaths are considered this breathing pattern. There we go. Yeah, yeah, yeah. We're getting this one well. And this is important for a couple of reasons. And we'll talk about why that is. And the correct answer for this one, as people are typing in the chat, is agonal breathing. Agonal breathing is defined as occasional gasping breaths, right? Now, it's not really even a breath. It's more like the chest heaves, but air doesn't come in and out, right? It doesn't do that. So importantly, the American Heart Association says these occasional gasping breaths are equivalent to no breathing when you're evaluating that patient in the beginning. Occasional gasping breaths would give you a CAB approach, even though does appear to be some chest movement. When do you use CAB? You use CAB when the patient is lifeless and doesn't appear to be breathing. Agonal breathing counts as no breathing at all. All right, great job. All right, size it up for 400 is the next choice. Let's do it. Going for the big money here in the size up. Oh no, a visual Jeopardy. What hazard identification system is pictured in this image? What hazard identification system is pictured in this image? All right, we're getting some of these. This is a specific system. This is, well, I guess it's a placard because it's affixed, but this is affixed to structures and tanks. This is not something movable like you would see a placard on a truck or a rail car. All right, we're even getting people interpreting these things. Well, a little bit more time typing. The blue, just in case you're ever asked, life hazard. The red is flammability. The yellow is stability. And then the white are special situations. And this is, in fact, an NFPA, the National Fire Protection Association 704 placard system. You may be asked to identify that, or you could be asked, what's the biggest risk here? Life, flammability, stability, or special hazards? And the correct answer here, of course, would be life, because that's the blue one. All right. We're moving along now. We're going through. I had a request for another size it up for 200. Oh, let's look at the big picture now for scene size up. Let's do it. Scene size up includes scene safety, BSI, resources that you might need, mechanism of injury, nature of illness, and this other important observation. There are 5 components of the scene size up. I like to call them decisions because they're really important. If you get one of these wrong, your call is going to go very badly. Graham and Josh and John, bam, got in there fast for this one. East Central Illinois EMS Systems even going with full Jeopardy format here. Yeah, this is a pretty important part, a very important part of the scene size up. As a matter of fact, the National Registry now includes some basic triage in their scene size up category for the exam. It's possible you might see a little bit more of that. All right. The answer here, pretty much right on the money, the number of patients. And that's a very important part of the scene size up, and it's one that's easy to make a mistake about. If you get the, bus full of Boy Scouts hits a van full of nuns and you get there and there's a lot of injuries, everybody thinks multiple casualty incident. But when there's perhaps 2 of you in the ambulance and one car with 3 people hits another car with 3 people and you have multiple injuries, that's a multiple casualty incident. Always think about those number of patients. All right. Very good. All right. I'm looking for the people who have picked here. All right. We have nothing from secondary assessment yet. So let's go for the top for 100. This abdominal quadrant is palpated last in a patient with suspected appendicitis. See the way I did that? I combined a little patient assessment with a little bit of anatomy and physiology to hopefully get you thinking here. Yeah, we're getting it. If there's a lot of good answers here, I won't stick around and wait a long time, although I do appreciate everybody participating. And it is correct. the right lower quadrant. There's two things here that you had to know. One, where is the appendix? And two, about abdominal assessment. You always palpate the part with pain last. If you palpate the quadrant that's got pain first, it's going to make it so everything hurts or the patient won't concentrate. So we start away from the pain and then gradually work down to the pain. And the right lower quadrant was, in fact, the correct answer. All right. Where are we going now? I know we have some risk takers here in the room. I'm going to go to primary priorities for 400. Readings below this oxygen saturation are considered hypoxia in the acute coronary syndrome patient. Readings below this oxygen saturation are considered hypoxia in the acute coronary syndrome patient. All right, I am impressed with everyone's answers so far. I am very impressed. Majority of you are knocking this out of the park. So to keep moving along here, we still have a lot to do. And by the way, don't go away when Jeopardy's over. I have 3 sample questions at the end. 1 multiple choice, 1 multiple response, and 1 TEI question I want to show you. Hi, Alicia. It's good to see you back. All right. And the answer here is 90%. You know, it was 2010, believe it or not, that the Heart Association gave out that 94 thing. Well, some sources said 90, and some sources still say 94, but a position paper came out at the end of February, which really sews this up nicely and says 90% is considered hypoxia. All right. I think this is a really important thing to remember. Now, this isn't the only thing to think about. If the patient's in shock, if they have respiratory distress, you may choose to give oxygen. However, the person that has chest pain has no respiratory distress and they seem stable. If they've got a SATA 92, they're not getting oxygen. That's what this is about. Okay, coming back to this, what do we need to pick? Oh, I'm going for some pathophysiology. What do you think? I think pathophysiology is the key to this. This happens to the vascular tone of a patient who is experiencing anaphylaxis. The percent for hypoxia in an acute coronary syndrome patient is 90%. Now, there's no similar rules out there for stroke. I would think it'd be similar, but stroke, they're still saying 94% for stroke. And the goal isn't to get people to 100%. In the acute coronary syndrome, get them to 90. The stroke and some of the other conditions are saying 94 to 98. Limmer Education has 2 free podcasts on pathophysiology-based assessment. These are rocking podcasts. I got to interview my good friend and competing author, Joe Mistovich, for these. I'm going to ask Limmer Education to maybe put a link to those in the chat. They're free. If you want some assessment stuff, you struggle with pathophysiology, this might be the thing for you. So we'll put that link there. And we're getting this. What happens to the vascular tone of a patient who's experiencing anaphylaxis? And terminology is so important. The vascular tone decreases. Now, it's very important that we do this, that we understand about vascular tone. Now, vascular tone, we should know the term, but essentially it's synonymous with the word squeeze. So the amount of tone is the amount of squeeze or constriction of the blood vessels. If I have increased vascular tone, my blood vessels get smaller and my blood pressure goes up. However, in anaphylaxis, I lose vascular tone. It decreases, and that's how it causes shock. So decreased vascular tone is the answer. All right. So we're going through here and picking. We have something else to pick. Twan from Chicago, the Black Fire Brigade. Give him a shout. Hey, all right. I'm going to go on the 300 and do second assessment. All right, there's that link for 7 Things Pathophysiology. It's a 2-part podcast. It's awesome. And second assessment for 300. A patient who reports their feet are swollen and they've gained weight is experiencing this side heart failure. If there's things that my students struggle with, I can think of a couple. One is left versus right-sided heart failure. The other is trends in vital signs. That's something that's always good to work on, knowing what's what with those trends and vital signs. Blood backs up where it's coming from. That's exactly right. And that should point you to the correct answer, which I think we're doing pretty well here. I want to make sure we get going here and not keep you here all night. Let's put that answer up on the screen. Right-sided heart failure. Now, the feet are swollen, pedal edema. You could also have sacral edema if a person isn't up and around a lot. And weight gain is something we don't think about. A liter of water weighs 2.2 pounds. Do you know a cardiologist will tell somebody with fluid problems with right-sided heart failure to weigh themselves at the same time every day? And if they gain more than a couple pounds suddenly, to call them, they have to increase their water pill. So right-sided heart failure, don't forget to ask about weight gain. Now, in this case, you may also see JVD. Okay, coming back, I had someone that chose here. Let me go back and see if I can find it. Secondary for 500. We're going for the big guns here. The absent lung sounds from spontaneous pneumothorax are usually found in this area of the lung. Trinidad, welcome. Glad you're here. See, I'm trying to get a lot of stuff in with this. I'm getting some good answers. I'm keeping an eye in the chat here. It would be in the pleural area. Air does accumulate there in the pleura. The pleural potential space becomes this actual space. Get a little bit more. We're coming up with some, pretty much got the good answers. You know, air rises. Now, blood in a hemothorax would probably be found at the base. But, and here's the answer, the apex, the top of the lungs. All right? Air rises. Now, we talk about spontaneous pneumothorax, and we think about horrible difficulty breathing, and sometimes they're hard to find. Here's a couple tips. Listen to the one apex and then listen to the other corresponding side so you can compare them. A small pneumothorax may be very difficult to find. You might not hear the difference, but know you've got to listen to all of the areas of the lungs to be able to do that. And the number one sign that you find in a patient, or number one symptom that you'll hear, is pleuritic chest pain. One source says about 85% of people who have spontaneous pneumothorax The most common complaint is pleuritic chest pain. All right, we're going to go narrow some of this down here. Primary priorities for 200. Your AED just delivered a shock. You do this next. All right, Adrian, we'll get 300 pathophysiology next. All right, we've got a really smart group here tonight. I like this. And when I see a lot of people putting in right answers, I'm going to go a little bit faster. I don't want to keep anybody from responding, but your AED just delivered a shock. You do this next. Begin compressions. We do not check the pulse. How about that? We do not check the pulse. I think that's really important to remember, to not check the pulse. All right? So in this, we should be hovering over the chest when the shock is delivered and then start right away. There's a couple reasons for that. One is that even if there was a pulse back, we probably wouldn't get a blood pressure. So pumping is not bad to do. And we want to increase compression fraction, the percentage of time during a code that we're actually doing CPR. The American Heart Association wants 80%. Can you match that? All right, so we had pathophysiology. Oh, we had 300 on there, but I think we used that one. Let's do 400. Let's go big. A patient's heart rate would likely do this after taking a beta blocker medication. All right, there are so many words here that we're using. Slow, drop, plummet, decrease. Yeah, that's really important. We're getting this. Tom Brady. It would slow down. Maybe Tom Brady is slowing down. I don't know. Doesn't seem Belichick is. So a patient's heart rate would do this after taking a beta blocker medication. Remember, beta 1 speeds up the heart. If we block beta, which would be beta 1 and beta 2, it would slow down the heart. Very important. All right. I'm going to do assorted assessments for 300. Here we go. Oh, the average adult BVM contains this volume of gas. How much air will go in an average adult BVM? We got a lot of numbers coming out here. This, I think, may surprise many of you. Only one person, there's two, have got it right so far. It's not asking about how much to deliver. It's asking how much is actually can fill the bag. I'll give you a hint. It's much more than needed for the ventilation. Some EMS systems are actually going to the higher size pediatric bags to ventilate adults because of this. And the correct answer, now we're getting it, the correct answer is about 1,500 ml. Now, how much do we need to deliver? The correct answer is just enough to make the chest start to rise. How much does that take? Generally only about 400 to 500 mLs, which means the bag has 3 times what we need. I can remember as a young EMT trying to flatten the entire bag and just fill, and holy cow, there's no place for it to go. So 1500 mLs can fill that bag, but we only need a third of that. All right. Secondary for 400. Here we go. I got a request. The pulse pressure does this when increased intracranial pressure is present. If you've ever seen a patient with increasing intracranial pressure, you may find very, very high blood pressures. I've seen things go over 220 systolic, over 100, 120 diastolic, but think about that. And remember how I said vital signs patterns are very challenging to remember. So if I'm in shock, I may have a narrowed pulse pressure, 102 over 88. But if I have increasing intracranial pressure, which I hope not to have, my blood pressure could be 240 over 120. And what's my pulse pressure there? 120. The pulse pressure widens when the blood pressure rises as a result of increased intracranial pressure. So the pulse pressure actually widens when we have increased intracranial pressure. So it widens. And we talked, as I mentioned here, of Cushing's triad, where we have an increased blood pressure, a decreased pulse, and I'll say irregular respirations, forming that triad that occurs in this situation. All right, we are winding down now. We've got about 20 minutes to go. Let's go back up and get rid of some of these 100s. So the answer for that last one was widens. And here's the next one. The M in the March mnemonic means this. The March mnemonic is getting out there a little bit more. What does that M mean? It's the last night of EMT class in the East Central Illinois EMS system. We got 15 students there. Well, good luck to all of you. The March mnemonic is used in the TCCC course, the military course, some of the trauma courses. And Brad and Sheldon, LJ, Kendra are getting this. Luke said, I don't recall this one in class, and you may not have had it. I do try and put some nooks and crannies in here. People have told me they've seen this mnemonic being used in the exam. So I put it in here, and the correct answer, massive hemorrhage. So massive hemorrhage, airway, respirations, circulation, and hypothermia. Hypothermia worsens shock. We should address that early. It's very bad. Melanoma? No. All right, let's go on and rewind this. I got some other questions to do here. Let's do size it up for 300. The most senior person arriving at a multiple casualty incident scene dons this vest. KCC EMT class. Hey there. Thanks for being here. The most senior person arriving at a multiple casualty incident scene dons this vest. There we go. You know, I've seen a comment in here which people generally think. You say, oh, I triage. But the fact is that the first person that comes in becomes the incident commander. If you're the senior person on the truck that's going in there, you've been elected to be the incident commander. And triage would be done first, and it depends how big the scene is. I came from an EMS system. I went from Colony, New York. There was a policy. Anytime there were 3 or more patients, even minor patients, the command vest had to go on. You play the game the way you practice. The correct answer is the command vest. And you have to look at the big picture before you do triage. You need to look at that big picture to see what resources are needed. If there's any dangers, how big the scene is, to call for additional help. The command is the first thing that's done. That get that vest on, do a big picture size up of the scene, then you can get in to triage. All right, let's go up to the top here. Pathophysiology-based assessment for 100. Heart rate times stroke volume is the formula for this physiologic parameter. Brazosport EMT. I drove through there the other day. Welcome. Heart rate times stroke volume is the formula for this physiologic parameter. Georgetown Scott County EMT class as well. Welcome. Look at you. You guys are slamming these. This is awesome. All right, if we're flying through this, if you're looking at the live chat, you're seeing that right answer come up there quite a bit. That right answer is cardiac output. Heart rate times stroke volume is cardiac output. So let's say my heart beats at 70 times a minute, and every time my heart beats, my left ventricle pumps out 70 mLs of blood. But now I start bleeding. Now I've only got 50 mLs of stroke volume. How do I increase my cardiac output? By increasing my pulse. That's why we increase the pulse, because that will help us increase our cardiac output. Blood pressure formula is cardiac output. Then we factor in the vascular resistance or tone. And that's what puts together the blood pressure. April, hello. Martha's Vineyard. Holy cow, prepping for the final exam. Welcome. All right, we got people from all over here. I love this. All right, let's do a started assessments for 400. A patient who is asked to repeat a phrase, but instead says random incorrect words, is experiencing this. Citronia Ambulance Corp, welcome. A patient who's asked to repeat a phrase, but instead says random incorrect words, is experiencing this. Shout out from Anaheim, as in California. I'll be out there a little bit later this month. The paramedic accreditation conference is out there. Schizophrenia? No! This is something that may be seen in a stroke. Yeah. All right. This, it's funny. Now you may see, I'll put up the answer here. The answer is aphasia. Now this would be expressive aphasia. You say, can you say, you can't teach an old dog new tricks, and they say da 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 da. That's expressive aphasia. Receptive is when you can't code it. All right. And that's it. Now, that's important because dysarthria is different. Dysarthria means the nerves that control the muscles or the muscles themselves aren't working. So let's say your tongue suddenly doesn't work. Your speech is going to be slurred, right? But it'll be the right words. This aphasia or dysphagia is the wrong word, receptive or expressive. When we have dysarthria, that's the muscles of speech that are affected. See how we sneak all these little things in? All right, let's wrap up some 200s here. Too many beers can do that too. I will give you that, Luke. A patient with partial thickness burns on their chest and anterior left arm has been burned in this body surface area percentage. Read this carefully. A patient with partial thickness burns on their chest and anterior left arm have what BSA percentage burned? All right, for all of you saying 18, read this again. There's 3 ways you get a rule of nines question wrong. One is by not knowing the rule of nines. One is by not reading carefully and figuring out what's really burned. And the other one is a math problem. LJ, it doesn't matter if it's an adult, child, or infant on this one. The only difference between the young ones and the old ones is in the legs and head. The legs drop in our littlest ones to 13.5 or 14, and the head doubles to 18. But all the rest stays the same. All right, the correct answer in this is 13.5%. How do we get that? The anterior chest, all right, burns on their chest is 9%, all right? Half of the arm is 4.5%. Now, don't confuse the chest with the torso. The whole torso is 18, but the chest is 9, the abdomen is 9. And the anterior left arm is half the arm. The arm is 9, but we're only counting 4.5. Exactly. That's how, remember, rule of nines is pretty easy. Reading and math are what are going to get you in these. All right, getting rid of some of these 200s, going to pathophysiology-based assessment. Oh, this is the amount of dead air space in the lungs of an average adult. We will have this recording up on our on our YouTube page if you ever have the urge to go back or share it with somebody else. Oh, Lucky, you're welcome. Thank you. What's interesting is that this amount doesn't change. And that's how one of the big reasons respiratory failure happens. My average breath is about 500 mLs. My dead air space, as we're seeing here, is, I'm going to put it up on the screen now, is 150 mLs. That doesn't change. My tidal volume can change. So my tidal volume might be 500. Let's get rid of that 150 that doesn't reach the alveoli. That's what dead air space is. It's the air that fills the tubes before we get to gas exchange. Gets me to 350. What happens if my tidal volume drops down to 300? That 150 doesn't change. Now I'm only getting 150 mLs of alveolar volume. And that's why it's important. All right, last 200 assorted assessments for 200. Oh, the B in the B-Fast stroke scale. stands for this. And you know what? I expect a lot out of this creative group here. I think there's going to be a lot of great answers and probably a few good ones, funny ones in here as well. Hey, first priority EMS. Oh, thank you. Oh, you're getting this, man. The whole Cincinnati Pre-Hospital Stroke Scale FAST exam, we have to do more. Dystaxia or ataxia, lack of coordination, is very big. The B, well, let's pop it up here. We're getting the answer. I'm just going to pop it up. Is balance. The E is eyes. Lack of coordination and vision problems, blurred vision or double vision, diplopia. I've had in the past year in my small city, I've found 2 posterior strokes because of dizziness, and one person had trouble swallowing, dysphagia. So you have diplopia, dystaxia, dysphagia, right? Dysarthria, that movement of speech. A lot of those D's that come together are really important. All right. Oh, we have 2 left. Let's size it up for 500. We'll get to a couple practice National Registry questions. An MCI patient with a respiratory rate of 32 is tagged this color. So when you do your face, arm, speech, and time, add balance and eyes. You have a patient lying down. The way you can test for balance, hold your finger out, have them touch their nose, your finger, their nose, your finger, and do it with both arms. We don't give a lot of attention to respiratory rates. They're kind of a pain in the you know what to take, and we don't always recognize the value of them. Now, while there are different triage systems out there, the START and Jumpstart, and there's another big one out there. His name's escaping me right now. The general things that we tag people red for are altered mental status and shock. And the other is rapid respirations. A rate of 32 would be tagged red. This is why we don't pay attention to respirations enough. In the American College of Surgeons trauma triage guidelines, respiratory rate greater than 29 indicates taking the patient to a trauma center, right? That's how important respirations are just on their own. And they think that's worth more than mechanism of injury, just for the record. So a rate of 32 generally means a very sick patient, right? Trauma, sepsis, anything. Got to pay attention to rapid respirations. They're there for a reason. Kussmaul's breathing, right? In a diabetic ketoacidotic patient. That's important. Okay, we're at the last one now before we go to a couple of additional questions. Pediatric patients experiencing hypoxia differ from adult patients by exhibiting this sign. What do the pediatric patients, when they get hypoxic, what do they do that adults often don't do? There's a lot of good things in here that are there. All right. Well, the last question's got a little Bit of controversy. I like that in a question. What I was thinking was bradycardia. Adults, when they don't nasal flare, I'll give you that. I mean, I will give you that. And kids may have more retractions because they've got less chunkiness sometimes in there to be able to see it. So in this, remember that kids, when they're hypoxic, get bradycardic, right? And that's important. All right. So let's go. And I'm going to give you 3 National Registry questions, 3 sample National Registry questions. Let's take a look at these questions now. Here is the first one, straight multiple choice question, coming up on your screen. You're resuscitating a patient in cardiac arrest. After which event should you check the patient's pulse? Yes, LC Ready is totally updated to the new test. Whether you're EMT, AEMT, or paramedic, all our apps are updated. AEMT and paramedic changed last year. But we're out there. Not only will our EMT apps give you all the new style questions, have the patient assessment focus, we give you 2 diagnostic score reports in our exams. One that matches the National Registry categories and one that matches the category for your class, so you know where to study. And we have all the new question types. All right, we've got a little bit of a discrepancy here. The concept of the pulse check is something that we have to kind of get out of our head. Let's take a look at the correct answer here. The correct answer is choice C, after observing patient movement, sometimes called purposeful movement. If somebody starts opening their eyes or they start moving their arms or you notice respirations, when you observe movement, that's when you check a pulse. Otherwise, you don't check a pulse. That takes time away from CPR. Don't do it after a shock. You don't do it after a no shock advised. And you don't do it after 2 minutes. If your patient starts to look like they're alive all of a sudden, or if they start screaming, ouch, 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 with every compression, then, then I suppose you can do that. So the correct answer here is choice C, after observing patient movement, sometimes called purposeful movement. We don't check a pulse after a shock. We don't check a pulse after a no shock advised. We don't check a pulse after the first 2 minutes of CPR. All right, now here's multiple response. This is the kind of question you're going to see. I want to show it to you if you haven't seen it. In which of the following conditions is a loss of vascular tone responsible for the patient presentation? Select the 2 correct answers. And you can use A, B, C, D, E, and there's no partial credit for these. There are only 2 here that are correct. So Hayden says, so you're supposed to do CPR for an hour without checking the pulse. I don't know if you're going to do CPR for an hour anytime. At some point, you're going to call the code. But the Heart Association says compression fraction, 80%. And every time we stop CPR, including checking a pulse, we start losing perfusion to important places. All right, we gave you a pretty straightforward one here. You know, there can be any number of things. It could be which of these conditions are possible with these signs and symptoms. Could be medical legal, it could be medical, it could be trauma. But in which of the following conditions is a loss of vascular tone responsible for the patient presentation? Correct answers are sepsis and anaphylaxis. These are both distributive shock conditions. And distributive shock, think of distributive shock, is we got the right amount of blood, but it's being distributed poorly because we've lost vascular tone. Right? That's what our distributive shock says. Our blood vessels got big and our blood pressure tanked. Sepsis and anaphylaxis are the two choices. Tension pneumothorax and pulmonary embolus are obstructive mechanisms. Intracranial bleeding isn't really a mechanism of shock because there's not enough space in the head to bleed enough to get shock. All right, last question. This is what's called the TEI question. You would drag one cause and one treatment over for the boxes from the left to the right. The mother of a 2-year-old reports her child experienced a sudden onset of respiratory distress. The child appears anxious. Stridor is heard on inhalation and exhalation. Choose the most likely condition causing the patient's distress and the treatment you would provide. So give me one cause and one treatment. And the answer, there's enough information there to get the answer if you read the question properly. And that's how I'll finish with this last question. All right, Sarah and Graham and Spencer jumped right in there. Well, let's look at this. While people are typing in their answers, people are getting pretty good answers here, all right? The mother of a 2-year-old reports her child experienced a sudden onset. All right, remember that word of respiratory distress. The child appears anxious, all right? That's probably a little hypoxia. Stridor is heard on inhalation and exhalation. The two things that are going to help you pick this out, if you read this carefully, is the sudden onset and stridor. Why is that important? Well, epiglottitis doesn't come on suddenly. That's an infection that's going to build up. This kid was hanging out, boom, sudden onset of respiratory distress. Epiglottitis is an infection, has a prodrome. The kid's been sick for a little bit, if that was the case. Asthma. What's the sound you hear in asthma? Wheezing. What sound is here? Stridor. Stridor is an upper airway sound. Asthma is a lower airway condition. So if you read this question, sudden onset rules out epiglottitis and stridor rules out asthma, you can get to the correct answer, foreign body airway obstruction, right? I want you to read questions in that amount of detail. It's really important. So now you've got the right cause, foreign body airway obstruction. This is a 2-year-old, you do abdominal thrusts. But the people that say the National Registry is nothing like the street, you take a question like this, all the information you need to make the decision is there, and I sure as heck would hope you would think like this on the street, that a sudden onset with upper airway sound is going to make you think this 2-year-old put something in their mouth they shouldn't have. And that's how it's done. All right, I'm a little over my hour here. Just a couple more things to tell you. There's your answers, foreign body airway obstruction and abdominal thrust. Now, I do live weekly online reviews as part of the EMTreview.com subscription. I do a weekly review. I go over questions. I break down how to read and deal with National Registry style questions on EMTreview.com. Now, Limmer Education, we have changed all of our apps. The BLS exams have been out there now for about 3 weeks. Limmer Education was ready before those exams switched over. All of our EMT products are fully updated to reflect all changes with the exam and give you those TEI and multiple response questions to give you the best shot. So be ready for the new exam. Everything's there. We have our EMT review apps. We have our pass apps. They've got great questions there. They're going to challenge you. And we have EMTreview.com, which is a subscription product with lots of stuff. If you need structure, that's the one for you. Study plans and tests and my live review. so you can get to hear more of me for an hour a week if you choose to do that. There are QR codes on there right now, but you also can see a link in here about doing this. All right, you're welcome, everybody. All right, words of encouragement taking my remedial course. Listen, here's the thing. If you're taking the remedial course, pay attention. If you have to take remediation, either because you choose to or because you want to get more information, take the remedial course seriously. I do 20 hours of lecture. It's like a mini EMT class. People that take it and pay attention say, wow, I learned things I never learned in my EMT class, right? I learned things. So just take the remediation seriously. Think of it as a course. Take notes. Do really good things. And I think it'll give you a great chance to go and do this. All right. Good luck, everybody. Thank you. Oh, you guys are saying very nice things. I'm very grateful. Get out there, pass that test, and go out there and do good things for people. Be safe. And you know what? Have fun while you're doing it. EMS is really, really a blast. All right. You all take care. And thank you for being here. It means a lot to me.